Hi, my name is Anthony Costello. Today I'll be presenting about the effects of manual therapy on recovery. So recovery, it's a period of time that allows the body to repair and strengthen itself. You can do this through rest, refueling through nutrition, rehydration, repair, resynthesis, inflammation reduction, and restoration. When you think of recovery, there's typically two methods, active and passive recovery. Active recovery is your things such as jogging, walking, swimming, and cycling. It's usually short term and it involves low intensity exercise. It occurs during the cool down phase or after a workout. Passive recovery is your dedicated rest day. So if you have a 4-day split during a workout, like Monday, Tuesday, Thursday, Friday, Wednesday would be the rest day. That would be considered passive recovery. And this is using as little exertion as possible. Sleep is also another very important factor for recovery. Our body produces a hormone called cortisol, which breaks down tissues in order to provide energy. And during sleep, this reduces this hormone, reducing the numbers of tissues broken down, allowing for the muscles to rebuild. So a little bit about the history of manual therapy. It's been around for thousands of years. First referenced back in 400 BC. Medical professionals began using it in the 19th century, and it focused mainly on spinal and musculoskeletal issues. It started gaining popularity in the 1960s. So by definition, from the American Physical Therapy Association, manual therapy is skilled hand movements and skilled passive movements of joints and soft tissues. It is a treatment used by physical therapists, athletic trainers, occupational therapists, and other exercise specialists, but it's also a hands-on treatment, so it's not limited to these specialists. So if the technique can be applied by yourself, then that's fine. It helps with muscle soreness, motion impairment, and it increases the person's range of motion and flexibility. It allows the person to mobilize their joints and manipulate soft tissue. It reduces pain, inflammation, and restriction. There are multiple types of manual therapy. Not all could be listed, but here are a few. Myofascial release. It's stretching and manual pressure. It's somewhat like massage, but it focuses more on connective tissue. And you usually do it for muscle tightness. There's craniosacral therapy, which is palpation of synovial joints, and it relieves tension of the central nervous system. There's visceral mobilization, which helps internal organs. There's joint mobilization, which helps the joints. An example of this would be if somebody rolls their ankle and it's too stiff to move on their own, a trainer or an exercise specialist will hold the ankle down and move it themselves, so that way it can get some range of motion. And that leads us into our next thing, range of motion. Myofascial decompression. An example of this is cupping. It uses negative pressure to increase the blood flow. The effect it has on recovery, it is shown to increase function and promote faster recovery by relieving muscle tension and improving restricted joints. Joint mobilization loosens up joints and improves range of motion. Typically, people pull their muscles due to restricted joints. Myofascial release breaks up fibrous and inelastic tissues. Strain counter strain helps relieve muscle and joint pain and dysfunction. Muscle energy technique allows shortened muscles to be lengthened, which increases blood flow. It restores muscle activity and decreases nerve irritation, which allows for the body to move flexibly and comfortably. It allows the muscles to relax, which can help with an increase of blood flow, and it can reduce lactic acid, which is your main cause for muscle fatigue and soreness. A little bit more about blood flow. This is important for healing and maintenance, as an increase of blood flow supplies the muscles with fresh oxygen, which breaks down glucose to provide our muscles with fuel. It brings waste back to the kidneys, which allows for faster recovery, less soreness, and healthy tissues. And that is it. Thank you for listening.